Hello, my name is Dr. Elizabeth Phillips from Vanderbilt University Medical Center, where I'm a physician scientist who studies DRESS syndrome. I hope everyone is doing well on this National DRESS Syndrome Day, July 16th, 2023. The theme of this year's special day of acknowledgement is Dress Smarter. So how are we smarter in 2023? Understanding risk is the key not only to earlier diagnosis of DRESS, recognizing signs of severe DRESS and following patients for complications after acute DRESS, but also to preventing the occurrence of DRESS in those carrying high-risk HLA alleles. The top 5 drugs causing DRESS have not changed considerably over the last 15 years, and patients starting on these drugs need to know that they are at risk so they can stop treatment at the first signs of a reaction. Although we have come a long way, there are still many gaps that need to be prioritized. We have to understand, for instance, why not everyone with a specific HLA risk allele develops DRESS and other severe cutaneous reactions. And we need to understand more comprehensively the risk factors for development of DRESS due to a specific drug. We also need to recognize the early signs of severe DRESS and the best way to treat it. For instance, we now understand that specific features such as facial edema and purpuric skin rash are associated with more severe DRESS. We need evidence-based randomized controlled studies to define the best treatment approach for DRESS, and we need standardized ways to assess DRESS severity to define important and measurable outcomes in these studies. Systemic steroids have been the mainstay of treatment for DRESS, but patients with milder disease may respond to topical steroids, which have less side effects. In addition, long-term steroids have significant side effects, and we need to understand whether pivoting earlier to steroid-sparing agents in patients with severe DRESS may have better short-term and long-term outcomes, such as reduced viral reactivation, reduced DRESS relapse, and reduced autoimmune complications. Advances have and are being made in the use of integrated diagnostic approaches that include genetic testing to identify a culprit drug and improve future medication safety and options. DRESS is fortunately an uncommon illness, but it can have devastating consequences, and innovative approaches such as the use of artificial intelligence and natural language processing to find DRESS cases in the electronic health record are furthering knowledge on DRESS risk presentation and recognition. Finally, to narrow our knowledge gaps, we need team science and national and international networking and collaborations to be able to define an evidence base that will define risk and provide the best possible options for prevention and treatment in our patients.